Hold on, I'm fixing myself here. You got me on camera doing that. I'm Steve Adubato. More importantly, we want to introduce and welcome Mr. John Rutkowski, who is Program Director, Respiratory Therapy Program, County College of Morris. Good to see you, John.
Good to be here. Thank you.
You know, first of all, a lot of people don't even know what a respiratory therapist is. What is it?
Respiratory therapists are a relatively small group of professionals that work in hospitals compared to nurses, which everybody's aware of what a nurse is and what a physician is. So respiratory therapists are a specialist that help the patient deal with breathing problems. So we're always seeing patients who have chronic obstructive lung disease like emphysema or cystic fibrosis is another example. Treat asthma patients.
How did you even get into this?
I actually, one of the first jobs that I had when I was actually going to engineering school was working in a small hospital in Jersey City, and the position that they held open was for a respiratory therapy. We called it inhalation therapy back in the, in the 60s. In the day. So that kind of gives you an idea how the profession evolved. But, so I needed money. I took the job, and I had this wonderful mentor there who was, we were allowed to be on the job trained back then. And I learned a tremendous amount from this nurse that was kind of leading the department. And
you know, it's so interesting. You talk, John, about what you learned from someone else. But what interests me about you, as I was reading about your background, is that beyond the clinical side of things, beyond the technological advances in medicine, your obsession, tell me if I'm wrong, is coaching and teaching students about the importance of empathy, about connecting with their patients on a human, personal level, about communicating with them on a human, personal level, beyond all the technology. Fair assessment?
Yeah, absolutely.
Why are you so caught up in that?
Because when you're treating the patient in a way that helps you gain trust and develop a relationship, everything is much more simple. It goes faster, it goes quicker. The patients get better results. Patients get out of the hospital
Give me, for
quicker.
instance, why can't a respiratory therapist or any other clinical professional come in and say, why can't you walk right to the technology first, do what you have to do with the patient, and if you have time, talk to the patient later? What's wrong with that?
It's just the wrong way to do things. In my mind, and I think in minds of many other people, you need to first thing you need to do when you get into the room is address the patient. And I tell my students, I don't even care if the patient looks like they're unaware of what's going on. You always go to them, address them, maybe hold their hand for a little while you're talking with them. Yeah, because they may be aware of what's going on and they just can't show it. So you need to make sure that the patient's aware of why you're there, who you are, and then you can take care of the technology. The technology these days kind of takes care of itself for the most part, unless there's a problem that has to be addressed. But if you ignore the patient, very often, even if they are comatose, when they wake up, they'll remember bad experiences.
It's so interesting. I think back to the whole concept of humanism in medicine, which our good friend Dr. Arnold Gold, who people know us in public broadcasting, he's been a giant in this industry for years, and he was friends with Patch Adams, the movie Patch Adams, where this whole concept of humanism in medicine was introduced. It wasn't called that. But is that a lot of what you're talking about? Yeah,
it is. And again, it's a lot about developing positive relationships with patients, making the experience better for them. You know, hospitals have always been concerned with patient satisfaction.
Right.
They do surveys. And you always get complaints and various things, and a lot of the people attribute it to bad food or something like that, or undesirable food. But some of the largest complaints are always about communications.
Not enough?
Not enough, or ineffective. If you're speaking to, I can talk to a doctor one way. I can't speak with a patient that way. Just they won't understand what I'm talking about. And if you're doing that, you're talking to them, but you're not communicating with them.
I'm curious about something. You know that I'm fascinated by the field of communication.
Yes.
I study it, I think about it, I write about it, I struggle with it. But here's the question I've often really struggled with. Can you truly teach empathy, compassion, and caring? Or is it innate in someone?
In many people, it's innate. It happens, and they, maybe from their upbringing, they may have carried that through to them. But you can learn to control your own emotions and help to manage the emotions of the patient through what we call emotional intelligence training.
The Daniel Goleman philosophy of emotional intelligence.
Well, the philosophy precedes Daniel Goleman. It goes back to as early as the 1930s when they started to talk about social intelligences. Dan Goleman was the one who popularized it.
Popularized
it's a fantastic book.
A must read.
Yeah, it's a must read.
But how does it relate? But it relates directly to medicine, clinical, and patient treatment.
Right. The two. It's a broad set of competencies, behavioral competencies that we can all learn to develop, and that's one of the things that makes it different in some people's minds from academic intelligence, where academic intelligence, some people think you can't really develop it past a certain point. But with social intelligence or emotional intelligence, you can keep learning things. And that's why I think sometimes you find that the older you get, the better you understand what's going on. So I'm always concerned about, and sometimes you see this where young people don't communicate well.
Well,
because they don't interact with people. They interact with
electronic devices haven't helped.
Right.
You know what's so interesting to me, John, is that you're also, bottom line is you are impacting future healthcare workers and others who are going to interact with patients, and the potential exists that they will be more empathetic, caring, and compassionate. That's a big deal. So John Rutkowski, Program Director, Respiratory Therapy Program at County College of Morris, I want to thank you for joining us and doing important work. We appreciate it.
Very good. Thank you.
Stay right there. Don't go anywhere. Right. I'm Steve Adubato. This is One on One. We'll be right back right after this. Thank you very much, John.